Hello, everyone. I'm Pharmacist Michael, and today I have Beki with me. Beki is the wife of a pharmacy technician that I work with at one of my jobs. And today I'm going to interview her about some health issues she's had. Thanks for coming on, Beki.
Thank you for having me.
So, my first question is tell us about your health condition, when it started, and how you got diagnosed.
Sure. So I'm going to go back a little bit, just for a full range of my conditions. When I was 5, I was diagnosed with vitiligo. At the time, they didn't know much about it until Michael Jackson was diagnosed, and then people knew about it more. Being fair complected, not that big of deal, but that was my first autoimmune disorder that I was diagnosed with. Then in my early 20s, I had Graves' disease and gestational diabetes. So those were kind of my conditions leading up to the big one. Um, so in, oh golly, 2009-ish, I in my right eye, it was like a sunrise or set. I started going blind just like this in my eye. It just started going. So obviously it was scary. I didn't know what was going on. I called my doctor. I was in a lot of pain as well. I felt like someone was stabbing me with a needle constantly in my eye. It was really painful. Um, I I went to the ER and they told me I had a migraine a couple times. Nothing they gave me helped. So I finally got into my ophthalmologist, who said there's inflammation of the eye, and recommended I go see Dr. Hills at the KCI Institute in Portland. Um, so I did, and they put me on steroids to reduce the inflammation, and did some general labs. Other than having a high SED or inflammation rate, I was okay. Like, they didn't know why. It was considered idiopathic. They didn't know why it happened. So idiopathic optic neuritis was at that point in 2009 what I was diagnosed with. Then I was fine for about 2 years. In 2011, in October, my left eye, so I was still mostly blind in my right eye. I couldn't see color. I could like see shapes, but that's about it. Then my other eye started going. I actually went into work early one morning, and my computer screen, I was working in my computer system, and the colors had changed. I thought. And it was like kind of spotty, like someone had messed with the colors of the program. And I thought someone was playing a trick on me. Honestly, that's what I thought. I thought someone is messing with me. And I, I was I was ready to call him and tell the person I thought it was what I thought about him playing a trick on me. Um, I also had pain in the eye, but I didn't really connect the two because I get migraines often, and I thought that's what it was. So I called another coworker and I asked her, I'm like, does your screen look funny? And she's like, no, it's fine. It's normal. And that's when I started getting concerned. I'm like, okay, it's not a trick. It's really something's wrong. It's all. And then I started looking around at like things closer up, and everything was spotty. It's like it, kind of like a fly's eye. Everything was just kind of spotted. So Again, I asked her to walk me to the ER, called my husband, told him what was going on, and the ER said it's probably a migraine. We don't know. Go to your ophthalmologist, which I did. I called my ophthalmologist, and they got me in pretty quickly that morning. Um, and again, my optic nerve was inflamed. Um, so I just want to say, I love my ophthalmologist now. He spent 2 hours with me sitting in the chair waiting on the phone to get a hold of the KCI Institute to get me in. Which a doctor to spend 2 hours on the hold for me was like a mind blowing. I was able to get in touch again with Dr. Hills, who is he doesn't work there anymore, but he was one of the 2 optic neurologists in the state of Oregon. So he got me on the phone. I couldn't drive, obviously, and Matt was at work and had the kids and was dealing with the other side of life. And so I he did a phone conversation with me, and with my history of my other eye, he was concerned that I had something called neuromyelitis optica, because of how I was presenting. And there, he told me, which I did do. He told me not to Google it because that is a lot of information out there is incorrect. And like the lifespan of a person is probably the biggest one because it says 2 years online. Um, yeah, that's really old data. But anyway, it's not right. So do not Google it, and expect correct answers. The Mayo Clinic has a good one, and the Guthrie Jackson Foundation has an NMO website. Those are the best. Just throwing that out there right now. Anyway, so he said he thinks I had that, and he wanted to pre-admit me and put me on plasmapheresis. So if you're not familiar with plasmapheresis, it's basically a machine. It's similar to dialysis. They hook you up to a machine, they take some of your blood out, and they flush all the bad stuff out of it, and put it back in. That's the simple version. They flush it out, put it back in. So he wanted to do that. And I agreed. And Matt took me up there that evening to get admitted and get plasmapheresis. Unbeknownst to me, Matt was also having a conversation with the doctor to talk about doing what, because plasmapheresis is every other day for 5 times, so 10 days. On the off days, what, could it flare up again? And the answer is yes. And so at the time, they didn't do anything for you on that off day. They just hoped it would not come back. So Matt had a deep discussion with Dr. Hills, and they decided to put me on steroids on my off days. The plasmapheresis takes out the steroids, but at least you have coverage on that off day, so that you don't get attacked further. So I went up there. When I went up there, I could, my right eye, urgent eye, could hardly see. My left eye I could make someone out if they were really close to me, and that was it. Like, I knew people came into the room. I don't know, couldn't tell who they were until they started talking to me. Then I recognized their voice. So it was very scary. Just put it out there. It was scary. So they did a spinal tap for a final diagnosis that at the time was only processed at the Mayo Clinic. So they had to ship it to the Mayo Clinic to get processed and then get the result back, which takes 9 weeks. Obviously, if I'm going blind, 9 weeks isn't good. So they treated it as it was, and it turns out I was positive for it. Um, and on the third day, so we're Christians, we believe in God, and we had friends, family. A friend was at a men's retreat in somewhere back east. There's about 500 men there praying, and lots of people. My mom's church down in Arizona, our church is up here. And on the third day, I woke up and my left eye, had my color vision and my vision back except red. Red is the first one you lose and the hardest to get back, just so you know. And then my vision in my right eye, which should not have gotten any better, it should have only gotten worse. I could see peripherally now and kind of make stuff out. Like I have a very, very small center blindness now, and my color came back as well. So our doctor did not believe in God, but he said it shouldn't have happened. I should not have gotten my eyesight back. I should have been worse off than I am. So
Wow.
that's yeah, that's my NMO story. So then 9 long months of steroids, and then for the rest of my life, or until they come up with a cure, which there is not one, I will be on some sort of immune suppressant. Currently, I'm on Rituxan, or the generic of every 6 months. I get a dose to lower my B cells down to zero. The goal is zero. But if they start coming back up, that's when my body could attack itself. So NMO basically, I like to put it in the basic terms because my brain is very basic. Um, Basically, your immune system's attacks your myelin sheath in your optic nerve or your spine, often your C-spine or your brain. So there are a lot of people with NMO who have different symptoms. That's one thing about the disease that's odd is there's people who are blind, there's people who can't walk, there's people who are both, and anywhere in between. There's kind of a mixture of us. We have a support group on Facebook, and it's wonderful having that support there. I didn't have that the first 2 years, and I think there's a lot of new people joining since COVID, and it's been great to be there for them.
I want to take us back to when you were at OHSU and your husband was talking to the doctor and you didn't even know it, but I actually talked to him about this. So
Oh yeah,
they did not want to give you those steroids on the
mm-mm.
off days.
No, they did
And
not.
I
Because that's
want,
not the normal treatment.
right, I want everybody that's watching this live or in the future to realize that sometimes you have to be an advocate for yourself, and they will change treatment if you're pushy enough.
They will, yes. The current treatment is steroids. He actually presented my case to one of their neuro conferences that they have, and after that, they changed how they do it. The current treatment is plasmapheresis steroids. So because of that, more people have potentially, like, I don't, it's plausible, I can't prove it, but how many more people have helped because Matt pushed?
Right. And this is a pharmacy technician. I wouldn't say he's just a normal run of the mill pharmacy technician. I think he's a pretty smart guy, but he was able to change the therapy for an entire
Country.
condition.
Yeah, for the whole country. It's now standard in the USA, and they're considering it in other countries as well, the UK and Canada.
And that, to me, that's amazing. It's absolutely amazing.
Yes.
Okay, Becky, how has this changed your life?
Um, how how hasn't it changed my life? So after I had this, I want to say about a year later, I started not being able. I was Afterwards, I was in a lot of pain. We thought it was steroids at first because I was on really high doses orally for 9 months taper. So it was like crazy high down. I don't remember the exact number. And so I was in pain all the time. It feels like someone took my nerves and set them on fire everywhere, not just in one spot. It's like pretty much everywhere, but my head hurts all the time. And I got to the point where I couldn't walk to the bathroom. Like we thought I was having an attack because I couldn't walk. I was in that much pain. So we went up to HSU again, and they did some scans, and nothing was inflamed. There's nothing wrong with me. I just couldn't walk due to the pain. So we went through a lot of different treatments. We tried, I mean, obviously, hydrocodone worked, but I didn't want to be on that for very long. And the doctors didn't want to give me what I needed to work. What it worked for me was 3 or 4 for about a week a day, and then down to 2. They would only give me 2 a day, constantly, and then they wait 2 weeks in between. And I'm like, that's it. I was still in so much pain. So we tried gabapentin. That for me, that didn't work. It just worked for some people. Um, then we tried Lyrica, and that helped. Definitely made a difference. And then some Balta up with along with that, which is also good for anxiety and depression and all that fun stuff that comes along with this disease. And that helped. And then finally, I met a doctor who used to work at the Mayo Clinic, and he's like, let's try low dose naltrexone. Naltrexone has a bad name, a bad rap, because it's used often for drug treatment. So if you're on it, you are a druggie. It's kind of the just out there, but it worked for me pretty well. I still get pain sometimes, but not nearly as bad. I can walk. I can't run with the kids. I can't climb very well. You know, long walks are no, about a mile, and I'm done. Um, so, and then, yeah, just, so it's been 13 years since my last attack, about, in October, it'll be 13 years, um, or 12, sorry, math is hard sometimes when you're counting years, 12 years. And yeah, I've been able to see my girls grow.
So are you back to normal though? I mean,
No, I used to run up mountains, like literally. I could run
okay.
up or down. Like um, I was like a deer. Like so, when I was younger, I could go like crazy. Um, I am not there back there. Nope.
But you can see.
I could see my so my left eye, the second one to go, I have some loss up here, so I can never be a pilot, which is okay with me. Um, I don't mind. That's okay. That's what they told me. It's like you can't be a pilot. I'm like, all right. And then my right eye, which should not have gotten better, that should not have happened. I just want to repeat that. Um, the doctor said not to expect it after a year of being where it's at. That's where they expect it to stay. But after the plasmapheresis, the steroids, and the prayer, it came back. I could kind of like I could almost make out that E at the doctor's office. I just can't see the middle line. I could see the top and the bottom when you're at the eye doctor, and I can see peripherally. I can see color, so I can see red. My red did come back in my left eye. So as far as my eyes are concerned, they're better than they were after the first attack.
And this is called optic neuromyelitis.
Neuro-optic
Neuro-optic myelitis.
myelitis. Yeah, and
Okay.
or wait, NMO, Neuromyelitis
NMO.
Optica. There we go.
Neuromyelitis optica.
Optica.
Okay.
Yes, because your neuros, your myelin sheath, myelin optica, your eyes.
Do you have any other pain now?
I do, not, it's still the fibromyalgia, not in my eyes. If I, what they say is if you have pain in your eyes or vision weirdness, like, any vision loss or funny floaters or anything like that for more than 24 hours, to call the specialist, because you could be having another attack. Um, so my eyes, I don't have pain, but I have the fibromyalgia pain still. It's not nearly as bad, but it's definitely there.
Did they ever bring up ketamine?
Um, I have asked about it. My doctor can't do that. Obviously, the PCP can't. The specialist, I haven't brought it up with them. My doctor is going to be asking a specialist to take my case on. So we'll see. To be determined. Maybe I can get back to you on that with another show afterwards in a few
Yeah,
months.
because
We'll
you
see.
did see the other Becky's story, right? That's how this
I
whole
did.
thing's happened. That's
Yeah.
how I got you on here.
Yeah, Matt showed it to me and
Right.
I was like, "Hey." Yeah, so I had thought about ketamine previously, but I just didn't pursue it because just I just didn't honestly, but I'm hoping that this specialist will take me on. If not, I'll talk to the neurologist at OHSU because they know people too.
Right. Becky, is there any silver lining to this?
If there any silver lining, um, there's a lot of silver linings. I've seen my kids grow. I'm not dead.
That's true.
Um, I've been able to help people on in our group. Um, on our NMO group. If you just look on Facebook for an NMO group, you'll find it. It's pretty simple to find. But there's a lot of great people on there who encourage you and help you along.
Okay. What advice would you give somebody who gets this diagnosis?
Don't believe the internet. First of all, it is not correct. I mean, I've um, been remission free for 12 years. So I'm not dead in two. I'm remission free for 12. That's a huge
Big
difference.
difference.
Big
Yes.
difference. I could see. Um, I'm still active. I can walk. I can, you know, I can still do stuff. I'm not crippled. There are some who are, and they still enjoy life. That's
Right.
the biggest thing. I think enjoy it no matter what you get.
Right. And
It's
you
your
have a good
choice.
support. You've got
I
a good
do.
husband for
I
sure.
do. Yeah. Yep. I do have good support with my husband and my parents, and my girls are great. They're teenagers now, so that they have their days.
Yeah. Oh, yeah. Yeah.
But they're wonderful. They support me and help me along when I need it. And yeah, um, there is hope out there. Don't give up. Um, there's people who do give up, and no matter what country you're in, also, different countries have different treatments, but be your own advocate, fight for yourself, because you know you you deserve it.
And how do they differentiate just a migraine from NMO? Because it sounds like the symptoms are similar. Is it that it doesn't go away?
It doesn't go away. It's your optic nerve is actually literally inflamed. Like it's like twice as bigger than it should be. Um, and then so that's where and usually there's more than one episode of optic neuritis. So if you have optic neuritis once, that doesn't mean you have NMO. If you have it twice, there's a good chance you do. Um,
Okay.
the test is available at a lot more pretty much every state you could do it in now. You no longer have to send it to the KCI, not KC, sorry, the Mayo Clinic. So most states have it somewhere in their state. It may not be in your local area, but it is available. There are people who come up negative for the test, but still are diagnosed with it because it is possible to be negative and still have it. And that's a really decision of your provider team. So I would recommend checking out the Guthrie Jackson Foundation website. They have a ton of information about the disease on there, how to get diagnosed, the different types. There's like transverse myelitis versus not. And I do want to say one more thing, or a couple
Okay.
more, I don't know. I also had a small lesion on my C-spine back here that was starting to present when I had my optic nerve at OHSU and was treated with plasmapheresis. That is gone. The last MRI I had, which it had been 8 years, you're supposed to do them every 2. I didn't. I don't know why, honestly. Got busy with life, kids,
Yeah.
stuff. The last MRI I had, so they do it with and without contrast. The neurologist at OHSU said I looked like a normal patient. Like I looked fine. There was nothing. If he had seen that MRI originally, he would have never diagnosed me because all the lesions that were there are gone.
Wow. That's good
So
news.
that is great news. That's not normal as well. So I believe prayer works.
Yep.
Um, and but I definitely think the new standard of having the steroids with the plasmapheresis that definitely helped.
I agree with you. So people definitely, I would say, find someone who has to go to the NMO group on Facebook, right? I mean,
Yeah, you're welcome.
find somebody that can help you through this. Stay positive. And, it sounds like you are doing all the right things. They can't even see any lesions.
Yep.
That really is amazing to me. And sometimes the doctors don't know. That's the other thing.
That is true. The doctors don't. He said, I think, I mean, because it was my second case of optic neuritis, he says, I think you have this and let's treat it like you do. It did take 9 weeks to get the final results back. But if I had waited 9 weeks, I probably would have been dead because it would have attacked my C-spine and then you can't breathe. And, that's kind of an issue.
Oh, yeah. Wow.
It's kind of important. So if I had not gotten treated then and not done nothing, no steroids or anything, it would have continued to attack my body.
Wow. Do you think it's related to the other conditions you have?
That's a good question. No one can answer that. I actually counted. I looked at all of my autoimmune diseases. So I have diabetes and a few others. And I have, if you count, so this is like how you count, right? I have low vitamin D, even though I take 100,000 units a week. And I have low B, even though I do cyancopolamine vitamin little shot because I can't take the pill. It comes back up.
Yeah.
I do the shot every couple weeks. I still have low vitamin B. I'm on the verge of being too low, even though I do it. If I didn't, I would be under. So if you count those two as autoimmune, I have 12 autoimmune diseases. Otherwise, I have 10 if you don't count those.
Okay.
So there are a lot of people in the group who have autoimmune other diseases. I think Thorgens, I can't say that right, is probably one of the most popular. I don't have that one, but there's a lot of people who do have other autoimmune things, such as thyroid, which I have. Diabetes is very common. probably because of the steroids, because
Right.
those don't help your blood sugar levels at all, but
Yep.
they save your life. So, you know, yeah, it's yeah, definitely if you're on steroids, especially the high dose, keep an eye on your blood sugar. Um, you can eat everything right and still have high blood sugar with steroids.
Right.
So,
That's true.
yeah, they're definitely. And I'm not a pharmacist, so anything I say you can't hold against me.
Yeah, but you've worked with them. You've worked with enough
I
of them.
have. I worked with many of them. Yes, a lot of great folks out there at the hospital. Um,
Yes.
yeah. So,
Okay, is there
yep.
anything else that you want to tell these beautiful people out there?
Just take one day at a time, take one moment at a time, breathe and be happy. It's a choice.
I agree with you. Okay, thank you, Becky. And I
Thank
would like
you.
to get you back on here.
Yeah, I'll let you know what who I get in with and what we do, and we'll see what happens. How's that sound?
That sounds great. Hi, Janet. I have Becky here. Becky is actually she might not remember this, but she's actually the person that taught me how to use Epic
Hmm.
years and years and years
Many
ago.
years ago, I trained you.
Yes. And I
Yep.
work with her husband. She has neuro. Why can't I ever remember this?
NMO. That's how I remember. I do it in sign language. NMO because it like kind of
Neuromyelitis optica.
yeah.
So she was diagnosed with this, and basically her lesions went away. It's a pretty major autoimmune disorder that can be deadly.
Yes.
But her husband, who I know very well, actually got the complete therapy for this disease changed by arguing with the doctor.
Hmm. Yep.
So now, because of him, people with this same disease are treated differently than they used to be.
They are. Yep.
And he's a pharmacy technician.
Yes.
So this is a perfect example of why you need to advocate for yourself.
Definitely. Always advocate, 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 advocate for yourself, advocate for your loved ones. It's worth having that discussion or argument with the doctor. Their life could depend on it.
It is a powerful story. And, when he told me that, I'm like, I have to get her on there. We've got to talk about this because people are scared. They're
It is
scared.
scary. Oh
They
yeah.
don't want to talk to the doctor because they're afraid they're going to get mad or they
Get
won't.
mad and not treat them right or
Right.
blow them off and if they do, you don't want that doctor.
That's what I think. That's
Yeah,
what I
if
think.
the doctor treats you like they don't have time for you, they don't have time for you and you don't have time for them. Find someone who will treat you right.
Right. And,
Just like
and
a
it makes you
relationship.
wonder. It makes you wonder if this happened with Matt. How many other times has this happened to change the way diseases are treated in this country because somebody spoke up and said, hey, why don't we try this?
Yep. Well, Devik, Dr. Devik is the one who is the other name for NMO is Devik's disease. He's the one who realized that it is Devik's disease is different than MS. They used to say MS was NMO. And my grandfather died of, they called it NMS, or my great grandfather, I'm sorry, passed away at the age of 35. Very similar symptoms that I had as far as blindness. His C-spine had lesions, and he died in a matter of, I think, a week and a half, maybe 2 weeks. Obviously, I wasn't there because it's my great grandfather, but
Right.
but that's the story from my aunt, who kind of knows the tribal knowledge of our medical history, and she said what I went through was exactly what happened to him, but he got treated for MS at the time. and it didn't work because most of the MS treatments don't work for NMO.
Right.
So the differentiating of Devick's disease, Dr. Devick is the one who realized it's different and changed the course of many lives for the better to, you know, so it's those little pushes, he
Right.
figured that out. Then there's this, then there's, little things can make a huge difference in all of our lives, in our future, in our children's lives. You never know.
That's right. And a lot of these autoimmune diseases are genetic.
Yes.
So, these could be passed on from generation to generation for hundreds, thousands of years.
Yeah. The doctors say, last I heard, that NMO is not genetic. But my opinion is it quite possibly could be because of, number one, what my grandfather went through. There are many people in our group who have had families with similar things in their past, and it is a newer disease. So I just don't think they know yet, really. That's my opinion. It's fairly new, so they're still learning. There is one FDA treatment, approved treatment, that just happened a couple years ago, and that was pretty exciting that there's actually something approved for it. There are many different drugs that are used for it that suppress specifically your B cells. And Rituxan is one I am on. There's Immune, there's a pill, there's a bunch of other ones. And really, we've had patients who have failed different drugs and tried new ones that they're working great for them. We have people of all ages. We have, I think the youngest one is 5, I want to say she is. And then we have people who are in their 80s who have been diagnosed with MS when they were younger and changed to NMO once they realized it's not MS. And they've had it, for 25, 30 years, and they're still trucking along. So just 2 years is definitely not correct. I just wanted to repeat that it
Yes.
is not an end of life sentence. More than anybody else has. That we all are going to die someday. That I can
Right.
tell you that, but not in the near future.
So what I'm going to say about that too is I talk to people about this all the time. If a doctor tells you that you have 6 months to live, that doesn't mean you have 6 months to live. The only person that knows I don't even want to say the only being that knows how long you're going to live is God. That's it.
That's
So
agreed.
I've had people in my TikTok lives that were given 6 months to live that are still alive 12 years later. And a lot of it is mindset. The problem is if they tell you that, a lot of people believe it and then it
They
becomes
becomes true.
true
Mhm.
because they give up on their life.
Don't never give up. I mean,
Right.
I have my girls and my husband to live for, and myself. Um,
Right.
and if you think you don't have someone to live for, I would combat you that you do. You have somebody who loves you, even if it's your dog. You have someone, and you should love yourself as well.
Right. It should be yourself first. I
Yourself
mean,
first, but yeah.
this is because we all are put on this planet for a reason.
Yep. And yeah, I've told my girls their whole life, they're here for a reason. I don't know what that reason is. It could be to be the next president when they're older. It could be to be the Queen of England. It could be to serve McDonald's to the
Right.
King of Dubai. I
Yep.
mean, it could be, it could be small or little. It could be to say hi to the homeless person who was going to commit suicide and they don't because you
Yep.
said you smiled at them. I mean,
God doesn't make mistakes.
no. So you never know what your smile or words of encouragement can do for someone.
Look what your husband did.
I know. He's
I
amazing.
mean, he changed an entire treatment
Treatment
plan,
plan. Yeah. Yep.
which to
Yeah.
me is just it's absolutely astonishing.
It is, it is. He fought for me, and
Yep.
I
And he had a
can
good idea and it made sense. I
it makes
talked to him, like I
total
said,
sense.
I talked to him about it and it made sense to me.
Yeah, the doctor didn't wanna do it because it wasn't the normal treatment. It's like,
And I think
well,
he said, "What do we have to lose? The
that
plasmapheresis is gonna take the steroids out anyway, so what difference does it make? It's not like she's gonna overdose."
right. Exactly. It's like, it's gonna go away the next day, so what's the harm?
Right. There is none.
There's a none. Yeah, the worst thing that can happen is I can not get worse.
Right. That's right.
Right? So,
Yep.
yep.
Wow. It's a great story, Becky,
Thank you.
and I would love to get you back on here. I
Yeah.
maybe one of these days I can convince Matt to come on and give us the backstory of
Yeah, 'cause I
exactly what he talked to the doctor about and how that whole conversation went.
yeah, so when I was in the hospital, I was hopped up on drugs. I just want to tell you, I was
Yeah,
on Ativan because I was very scared. I was
right.
on pain medicine. I was on a lot of medication. So my remembrance is very small. I remember on the third day being able to see again, start seeing again. And I remember on the second day them wanting me to shave and I couldn't see. And I'm like, what? I I'm like, I can't see my leg.
Right.
So I didn't. I was like, I was just um I was yeah, I was that those are the two things I remember. And a nurse that didn't want to give me my medication because I had just gotten my Ativan. She didn't want to give me my Ambien, and I'm like, uh, to in order to put me down, not put me down, but in order to put in my central line, they had to give me. The last thing I remember is them saying, "Okay, that's 11 milligrams of Versed and 9 milligrams of Ativan." And
Wow.
then I went out. So that I remember them saying that, and the doctor was like, "Really?" Like, she was just shocked because it was so high.
That's a
Um,
lot.
that is a lot. So, I am one of those people, it takes a lot to impact my body. Um, there are people like Matt, he could sniff an aspirin and get a bloody nose. I, on the other hand, could take 5 aspirin and I'd probably be okay.
Yeah.
Um, so we're all different, and that's okay, which is why medicine isn't 100% accurate because we're all different. And so the doctors have to adjust for each of us.
Yep.
But knowing my history, knowing that it takes that much to um, put me out for a procedure, I let the anesthesiologist know, hey, historically, it's taken a little more than most people, just so they know that don't be afraid to go a little higher. And then with Matt, I say, please be cautious, right?
Right.
So communicate with your doctor and your doctors. Um, they're not afraid to have a conversation with you. And if you have something to say it. Don't be afraid. Just um, yeah,
And if you don't like
advocate.
their opinion or you don't like the way
Get
your
another
treatment's
one.
going, yep, find someone else.
Find someone else. Our NMO group, we're all across the world. We have people from Japan and Egypt and everywhere in between. um, we would recommend a doctor near. If you let us know where you're at, we could probably find a good doctor. Because one of us are probably near you. We can find you a doctor that can treat NMO. Or there's Dr. Levy. He is the head NMO specialist in the United States. He will pretty much always do a consultation with with another doctor. So let's say you're in um, Alaska, and Dr. Levy's somewhere in the South. I can't remember what state he's in right now. Um, and that your doctor thinks it might be this. Dr. Levy, or pretty much most doctors will do a phone or video conference with them to talk about your symptoms. So be let your doctor know, hey, is there anyone you know or can find that knows about this disease? If he doesn't know, if your doctor doesn't know, he or she, that's okay. And if they admit it, that's even better because they're willing to admit they don't know something.
Right.
But they can find somebody. So ask them to conference a doctor. Say, hey, can you conference a doctor who knows about this disease? A specialist or a neurologist or somebody out there. There's always someone that your doctor can talk to help you. Especially nowadays, right? So,
Mhm.
um, 20, 30 years ago, it was not nearly as common. They picked up the phone occasionally, but now they can video conference and like we are now, we're talking over the internet.
Yep.
They could definitely talk securely, not over the internet, about your symptoms. They could have that discussion, and they could definitely help treat you appropriately and try to figure out, they know what tests to do to determine if it is or isn't. um, and then then they can move forward from there in treating you. So um, definitely advocate, ask for help, tell the doctor to call somebody, Dr. Lady, or anyone nearby that's a specialist. um, you can always find somebody.
Right. Okay. Thank you, Becky.
Yeah, thanks for having me.
And we will get you back in here.
Yep, I'll keep you informed, or Matt will
Okay.
let you know what's going on. It might be a bit, I don't know
That's
if
okay.
I've been accepted yet, but
Okay.
one
Yep.
of these days we'll chat again, and maybe we can get Matt in there too.
Yeah, that would be wonderful.
Yeah, we can both push him and poke him, see what
Yep.
happens.
Yep. Yep. We can do that. Okay. You have a great night. Thank you
You
again.
too. Thank you for having me.
All right.
All right, bye.
Bye, Becky.